tips for some smooth participation and some housekeeping rules. Some instructions and informations will be coming in through the chat, so please use the chat and participants windows to follow them. If you have a question or comments, please use the function of raise your hand. So this you can access by hovering over your name, or use also a chat for that. And note that we are recording this meeting and also chat window for our reference later. And we will have Q&A session after the presentation, but feel free to be asking questions as they go, and I will be compiling them for our Q&A session. As the Bear Care Group, we aim to improve the lives of bears through communication, cooperation, and education. And this is also why we are here today. Older bears, they come through changes, both physical and psychological. And we need to understand these changes in order to provide them with the proper care. And we couldn't be more lucky with our today's presenter, Dr. Heather Bacon. There could be plenty stated about Heather's experience and expertise. She's a veterinarian that has worked internationally on veterinary education and animal welfare projects for 15 years, with a focus primarily on bear health and welfare around the world. Please help me to welcome Heather. And Heather, the floor is yours.
Thank you, Aga. Okay, can everyone hear me okay? If you can hear me okay, can everyone just put their hands up? So that's good practice for if you want to ask questions anyway. But if you pop your hands up on your icon, then I know that you can hear me and I'm not just speaking into a void, which is always nice to know that there are real people on the other side of this computer screen. All right, that's great. I can see a few of you have raised your hands. That's perfect. Okay, you can put your hands down. If you have any questions, I do have my chat box open. I want this to be quite a casual and interactive and informal presentation. I'd also, so do ask questions as we go through, and of course I'm happy to answer questions at the end as well. I also would like to say that within this presentation, I am going to be focusing much more so on some of the sort of, I guess, quick wins that we can do from a medical point of view with the care of our bears. A lot of the information that you have received in previous webinars that will be available for future recordings would apply to your geriatric bears as well. So certainly don't look at the information that I'm going to give you in isolation. This is very much just a sort of keeper's guide, I guess, in some ways, to things that you can do to monitor the health of your bears, and using that in conjunction with the husbandry and enrichment and training information that has been given in previous webinars. So just trying to look at things from a slightly different angle. Okie doke, so let's crack on. Okay, so why do we need to be concerned about geriatric bear care? Well, in general, bears will live much longer in a captive setting managed under human care than they will in the wild. And that longevity, that extended lifespan, obviously can then be associated with multiple health problems. As with all of us, our health degenerates over time. I'm sure plenty of us are in the age bracket where we're starting to get niggles and aches and pains that we never used to get when we were younger. And obviously, as we progress through our lives, those niggles and those aches and pains become more chronic. We start to get more wear and tear on our bodily systems, and that obviously has health and welfare implications. So things like those degenerative conditions can create significant welfare problems for our bears. The other challenge that we have with our bears is that diagnosis can be tricky. Often those degenerative changes occur chronically over time. They can be very small incremental changes. We often don't see a sudden deterioration in health status. It's very subtle, small changes that occur over time. And quite often we put those changes down to old age, but old age itself is not a disease process. But there are lots of disease processes that we see more frequently with old age that we can manage, but we can only manage them if we first start to recognize them. And this makes our diagnosis tricky because of that subtle change over time. The other thing that I think it's really important, particularly for keepers and bear care staff to recognize, is that the environment and the husbandry that you provide for your bears can really affect their degenerative problems and their ability to cope and manage with their degenerative problems. So things like your enrichment programs, the way you design enclosures or dens can have a real impact on mitigating some of the challenges that older bears may face. And that's something to be aware of. Okay, so what kind of common problems do we tend to see in our older bears? Osteoarthritis is a real problem. There aren't an enormous number of studies done on osteoarthritis in bears, but the studies that have been done show that it can, signs of osteoarthritis can start from as young as 8 years old in some bears. Dental disease, we see quite a lot of, and that might just be due to traumatic injury over time. It might be because of previous husbandry challenges where bears who have had a history of being kept in substandard environments may bite at bars. It may be due to inappropriate nutrition. It may just be due to degeneration over time. Obesity, just as with our human population, we lead more sedentary lives, increasingly in the modern world. Our bears that are managed under human care also lead much more sedentary lives than bears might do in the wild. And this can predispose them to storing fats. Of course, particularly in our hibernatory, our torpor bear species, storing fat is a perfectly natural evolutionary mechanism, but we would expect that fat gain to be seasonal during the hypophagic period, and then for that fat to be lost in the spring period when bears wake up from their hibernation. So we need to be mindful of that level of obesity and ensure it's following that seasonal pattern and not just gradually increasing year on year. And associated with obesity, we often also see a lack of muscle tone. And we sometimes mistake a lack of muscle tone for obesity, but actually it's very, very possible to have a skinny fat bear. So bears that actually aren't carrying excess weight or that are a healthy weight for their size, but they're very flaccid and saggy. And that's just because they're not using their bodies in the way that they're meant to, and they're getting a reduction in muscle tone. And that is an increasing problem as bears get older. We might see an increase in abnormal repetitive behaviors, and there's a number of different reasons for that we'll touch upon. And then we often also see degeneration in the different body systems, and common things that we might see are things like ocular disease, so disease of the eyes, heart disease, liver disease, and skin problems or poor coat condition as bears get older. And we may also see associated problems with that, such as problems with the foot pads or the nails. So why should we care about our bears as they get older? Why should we be bothered about these problems? Well, as I've mentioned, the studies that have been done in bears and other large carnivores seem to suggest that a lot of these degenerative changes may occur in bears that are actually fairly young and not necessarily in that traditional geriatric bracket. If we think about our bears living up to an age of perhaps 30 or sometimes older in some cases, we would often consider a geriatric animal to be one that has reached 75% of its lifespan. And yet we're seeing some of those degenerative changes, dental problems, osteoarthritic problems in bears that are much younger than that 75% of their lifespan. It's also potentially a real welfare problem. So this was a paper that was published in 2007, looked at a number of large carnivores housed in zoos across Europe, and the pathologies that were found on those carnivores at necropsy after those animals had been euthanized, and found moderate to severe pathologies across a range of species, including bear species. And the authors suggest that the necropsies showed pathological changes of the organs and or musculoskeletal systems that were often already advanced, and hypothesized that euthanasia is often delayed to the detriment of the animal's welfare. So those animals were probably experiencing quite significant pain or suffering based on the pathologies that they showed at the time that they were necropsied. But because a lot of our wild carnivores mask their pain behaviors or don't always show really clear behavioral signs, then picking up on some of those quite subtle behavioral changes can be really challenging. And we'll look at ways in which we might do that a bit later on. So what's our alternative approach? The first thing that I think we could do a lot of work in terms of focusing on is preventative medicine. And preventative medicine is one of those terms that we all use, we've all heard it, but we still don't do it very well. We tend to be really reactive in veterinary medicine, and we tend to be really reactive in the zoo world. We're all busy, we have very little time, we have limited resources. And so it's perfectly natural to want to spend and focus those resources on the things that we deem to be urgent. And the things that we deem to be urgent are, you know, the animal that's limping around on 3 legs, or the ones that have really obviously overgrown hooves, or, you know, the ones that we think, oh, that really can't wait, that's really critical. That's where we tend to focus our time and our energies. And that's perfectly understandable. But if we can take a step back and start to implement a program of preventative health assessment, then actually we can start to pick up on a lot of those really subtle degenerative changes and behavioral signs, and we can implement our medical treatments at a stage when they're much more likely to be effective. So we want to focus on being proactive rather than reactive. We want to focus on keeping the animals healthy and preventing rather than treating disease. And we want to be tracking the animal's health and its behavior over time, so that we have a baseline of normal healthy behaviors and normal healthy physical condition. And that means that when we do notice changes, we have that healthy comparison to reflect back on, and we can actually demonstrate that, yes, there has actually been a change. So that non-invasive health assessment is really important at gathering that useful information that allows the early detection of health problems. So what do we mean by non-invasive health assessment? What are the easy things that we can do? One of the things that's really important and not very exciting, but really, really essential is record keeping. Having a system of consistently recording information on a daily basis is absolutely essential, because that's one of the fundamental ways that we can track changes over time. You can use a computer, you can use a notebook, but it's really important that every keeper who's looking after your bears is recording the same kinds of information, and also that everyone understands what is meant by particular terms or particular issues that you might want to monitor. So does everyone have a clear understanding of abnormal behavior? Does everyone have a clear understanding of play behavior, of social behavior? Does everyone have a clear understanding of foraging? So we all often take that kind of terminology for granted, but it's actually really important that everyone, and particularly new or inexperienced keepers, are have that terminology explained to them so that they're able to keep accurate records. And behavioural observations are absolutely essential. So we'll move on and talk about some of the things we might look at in terms of behaviour. Observations can be done by keepers, they can be done by veterinary staff, whether that's veterinarians or vet techs or vet nurses. But we can get a lot of information just through visual observations and through spending time with our animals. And the other thing that's really, really useful is the use of photos and video footage to develop a baseline record of what is normal for the animal, and then allow us to track any changes or abnormality over time. So we want our daily checklist, we want our computer records or our diary. We need to make sure this is accessible and easily viewed by other people. And often having these kinds of records is a requirement for either zoo licensing or sometimes for accreditation by some of the different zoological accreditation bodies. So as an absolute minimum, we want to be looking at things like food consumption, but also the appetite or the eagerness of that bear to get to its food. Are we seeing a lot of appetitive behaviors, a lot of stress or anticipation prior to feeding? And do we need to look at how we might feed different types of food or different volumes of food depending on the seasonality? We want to look at thirst and water consumption, and we want to also look at outputs such as urination and defecation and keep records of those things as well. The animal's demeanor is really important, and you guys look after these animals every single day of their lives, so you know what they're normally like and how they normally behave, and that is really important to note any changes in behavior. Bears are very subtle and stoic creatures. They often don't give anything away, and so very small changes in behavior can actually be quite significant in terms of building up that big picture of their health status. Things like sleeping pattern are incredibly important, particularly for our older bears. We often talk about bears slowing down as they get older, or just sleeping a lot more, and that being due to old age. But quite often, it's not old age in and of itself, it's some of those health problems that we associate with old age. Is the bear sleeping all day because it's painful? Is it sleeping all day because it has a level of cognitive decline? Is it sleeping all day because there's an underlying metabolic problem that we need to investigate further? So looking at sleeping patterns and activity levels and how the bear might use its enclosure, and again, having that baseline record of all of that information is really helpful. So demeanor, activity level, and then some of the physical things we can look at, things like respiratory rate. So how quickly is the bear breathing, and how deeply is it breathing? What kind of respiratory effort are we seeing? Do we have any discharges from the eyes? Any discharges from the nose? So you can see in this photograph is a bear with discharge from its nose. This bear had a tumor inside its nasal passages. And any abnormalities in the physical condition. And we'll come and look at some specifics of that as we go through. So mucous membrane colors. The mucous membrane is the pink area inside the lips and just inside the eyes that you can see. So you can see very nicely in this bear, he's got a nice pink, healthy mucous membrane color. We don't often tend to see significant changes in mucous membrane color in our bears, but it's good to know what the normal is for your bears. And again, just that can help to build a picture. And if we get any other changes in signs, in clinical signs, then that can be helpful as part of that jigsaw puzzle. The eyes, so we mentioned discharge from the eyes, but also can we see any other changes in the eyes? Is there any cloudiness, any opacities in the eyes? Perhaps we might get degenerative changes such as cataracts forming as the bear becomes older. We might see problems such as the lens inside the eye becoming loose and detached, and that can cause cloudiness as well. Even bears that are completely blind, if that is a process that occurs gradually over time due to this gradual opacity, then we might actually not notice any significant visual problems. Bears tend not to bump into things or, sort of show obvious signs that they are visually impaired. They have an incredible sense of smell, and they have very good hearing. So if their enclosure furnishings are staying broadly similar, then those bears may well be able to navigate based on their existing knowledge of what's in the enclosure, and also using their sense of smell and their ears to get around. So I've certainly had cases with bears that are completely blind, and keepers have been surprised by that because of how well the bear has adapted and coped and navigated its environment. So something to be aware of. Any wounds or skin disease. So this might be something like a chronic skin disease that degenerates over time. Things like allergies to environmental or food allergens. Or it could be a wound, or, you know, after an altercation with another bear, or due to an injury on enclosure furnishings, for example. So making sure you're doing a daily check of that bear's coat and its skin condition is really important. And of course, claws. So claws can give us a lot of information. If our bear is resting a lot and not moving very much, we might see an overgrowth of claws. Normal claw length does vary considerably by the species. Animals like sloth bears and sun bears will have really long claws because that's part of their normal sort of evolutionary techniques for raiding insect mounds. Some of the other bear types will have much shorter claws, and we might see problems with claws growing over if those bears are not active or they're kept on inappropriate substrates. Claws can sometimes also give us an indication of behaviors. So if your bear claws are dirty and perhaps a little bit frayed, that's a pretty good indication that your bear has been digging. So depending on the size of your enclosure, if you've got a really lovely large enclosure, you might not always be aware of that. So getting used to checking claws can also give you an idea of your bear's activity and what they've been up to. And then mobility for your bears. We want to be able to assess our range of movement. It's perfectly normal for all bear species to be able to stand fully upright on their hind legs. I know this photograph is quite dark, but hopefully you can see that. This is a bear standing fully upright, nice and straight on its hind legs. And sometimes what we see in our older bears is this kind of stance instead. So you can see the bear on the left-hand side, her hips and her spine are much more of a right angle. It's a 90-degree angle, not that lovely straight upright 180-degree stance. And this is often a sign of osteoarthritis starting to develop in the lower spine. So noticing if your bear is having to really make an effort to stand up on his or her hind legs, or is unable to stand up and extend fully, can be a really useful indication of degenerative changes occurring in the spine and the joints. And then body condition scoring. So depending on what sort of zoological management system you use, you might have different types of body condition scoring charts. I know that obviously the polar bear body condition scoring chart is traditionally a 1 to 5 scale. We have an Asiatic black bear chart, and I know a number of zoos have Andean and sun bear charts that are also 1 to 5 scales. But if you're using ZIMS as a management software tool, then the ZIMS body condition scoring is typically a 1 to 9 scale. So you might have a slightly different scale there. And as in visual body condition scoring is quite challenging across any species. Ideally, what we want to be doing is putting our hands on the animal and really feeling, am I feeling nice firm muscle? Am I feeling soft, saggy fat and untoned muscle? But of course we can't do that with our bears. So we are really looking at those sort of key skeletal markers, looking at the points of the shoulder, looking at the flatness of the pelvis, and also recognizing that for our bears who go into winter dormancy, that obviously those bears, particularly if they're fed a nice seasonal diet, their body condition score is going to change throughout the year. So we need to be aware of what's normal and what's not normal, looking at ideally their body weight, their proportion of body fat, and how toned they might be as well. And then we want to be sort of aware of their overall alertness and their response to stimulation. So how interactive are they with novel enrichment? How do they respond to it? Are they frightened by it? Does it make them anxious? Or do they really enjoy it? Are they suspicious of it? How sociable are they? How well do they get on with their companions if they're socially housed? If they're not socially housed, then do they have some kind of social interaction in terms of their keeper relationship? How do they respond to different types of interaction in different situations? What's normal for that individual animal? And then in addition to all of those things that we should be looking at on a daily basis, we can also think about behavior a little bit more in an in-depth way. And ethograms, or collecting behavioral data over time and presenting that in a graphical way, can be a really useful way of again, establishing what is normal for that bear. And if it's a bear that is seasonal, then it would be what's normal for that bear at that particular time of year. And can we monitor those changes over time? So what is our normal brown bear summer activity levels? And we can measure that year on year on year and see what those changes are like. Now, that's often quite challenging. If you're working in a zoo where you're really busy, you often don't have time to do that. If you do have interns or volunteers that you can recruit to help you with that, then that can be really useful. But if that's not possible for you, then you can often get a bit of a quick and dirty record of bear behavior by tallying what that bear might be doing every time you walk past the enclosure. Now, this again can sometimes be a bit of a challenge because you guys as keepers are often, you're the bringers of food and the bringers of enrichment, and simply your approach can change a bear's behavior. And I'm sure you've all had experience of that, where the bear stops what it's doing, comes over to see you because you bring good things. So we do have to be a bit careful of that, that you're not inadvertently changing the bear's behavior. But we might want to look at some of the different behaviours that are listed here, for example, just to get an understanding of what that normal behavioural repertoire looks like. So these are some profiles of brown and sloth bears, just showing you some of the sort of normal types of behaviour that you might see. But as I said earlier, we do need to be a bit careful that these animals aren't responding to the observer, and that they're also that their behaviours may change seasonally or over time. But certainly it's really helpful to have at least a baseline of what your bear's behaviour might be. They allow us to pick up on any kind of pleasurable behaviours or evolutionary important behaviours like foraging or exploration. And they also allow us to pick up on behaviours that might be problematic in terms of bear welfare. So abnormal repetitive behaviours, aggression to other conspecifics, or excess resting or sleeping behaviour, for example. And for a slightly more in-depth assessment, I just might as well flag that we've just recently published a paper. It's an open access paper in Animals that is a pretty reliable welfare assessment tool for bear species that do go through the torpor experience. So this was tested in brown and black bears in a number of different countries around the world, using a whole range of different measures, including a lot of the things that we've touched on already in this presentation. But by combining a whole range of different physical, environmental, and behavioral measures in a relatively short assessment, that allows us then to get a baseline of what is normal for that particular bear and a score for that particular bear in terms of its behavior, its environment, and its physical health status. And then again, we can track those behaviors, we can track those changes over time. Getting that healthy baseline is so important because of the subtle degenerative changes that we see as bears get older. If we don't know what's normal to start with, then how can we know what's changed? Other things that are really important, particularly as our bears get older and are more likely to be prescribed medications, are around their sort of ingestion and absorption of those medications. So how compliant are they with taking their medications? Do we need to change the way that we give medications? Do we need to think about giving a slightly different medication if the bear really doesn't like it? Is any of the medication wasted? How is it given? What does the bear like? And actually, again, will its likes change over time? With some medications that are really bitter tasting, what you might find is that you can hide them in one particular type of treat for a period of time, but eventually, if that taste is really unpleasant, then the bear may well start to associate that particular treat with the unpleasant medication, and you have to change to a different type of treat to get the medication in. So just because a bear likes a particular thing at one time, don't assume that it will like that thing forever. So if you're starting to get a lack of compliance with medications you have to give, then think about changing how you're delivering them. And that obviously goes back to our record keeping, so that we can see what's been given, how successful was it, how keen was the bear to take that, how difficult was that medication to administer. Okay, so we've talked a little bit about some of the very easy, non-invasive things that we can record on a daily basis to evaluate our bear's health and develop that baseline so we can note any changes over time. But as I mentioned at the beginning, video footage is really, really helpful for us. Human presence may affect behavior, and if you have CCTV, then that CCTV can be incredibly helpful, particularly around sensitive periods such as the neonatal period if you have breeding bears. But even if you don't have CCTV, then just using your cell phone is a really useful tool for monitoring those changes over time. So as I said, a really useful tool for non-invasive monitoring. You don't need anything fancy. Everyone has a cell phone. It really allows keepers to capture any behaviors that are interesting or novel or of concern. And those videos are really useful for showing to your vets if you're trying to explain about something that you're concerned with. You can assess the bear's response to a medication to see if there's an improvement or if in fact the medication has not had any effect at all. And you can send that video footage externally. And I see quite a lot of video footage from different collections around the world, just asking for a comment or an opinion on a bear in a particular situation. And it's always so helpful to have that actual video and to really understand what the concern is. So just as an example of that, this is a polar bear who was spending long periods of time performing this behavior. She didn't used to do it when she was younger, but she started perhaps over the last 5 years or so, started doing this behavior where she was holding her face under the waterfall in her enclosure for quite long periods of time. And it was just assumed that she was enjoying swimming, that she was enjoying splashing in the water. But if you watch that video, you can see it's actually quite a specific behavior that she's doing. She's putting her muzzle particularly under the water and under the flow of water falling down onto her muzzle. And when I was sent this video footage by a keeper that was concerned about it, the next question I asked was, what are her teeth like? And when they trained her for an open mouth behavior, she actually had a number of fractured canine teeth and a number of other teeth that were also damaged. So she had quite considerable infection throughout her mouth, and that infection would be painful. And we'll move on and talk about pain a little bit later on, but pain is interesting because the nerves that process pain also process other sensations like heat and pressure. And this is why if you've ever had a pulled muscle, you might put on sort of a deep heat type preparation that sort of warms up the muscles. And the reason that makes your muscle less painful is because it confuses the nerve signal. So your nerves cannot transmit a sensation of pain and a sensation of heat at the same time. Equally, they can't transmit a sensation of pain and a sensation of pressure at the same time. And so I think that what she was doing here is she's learned that feeling of pressure, of the pounding of the water on her face, actually alleviated the pain sensation of the dental disease that she was experiencing. And that's why she was spending such long periods of time doing this behavior. I'll just turn the sound down on that. So videos can be really helpful. This is another little old bear that I used to work with, and you can just see if you look at his back legs that his gait is really quite abnormal. So we've got quite a sort of high lifting of his back legs, and that's usually suggestive of problems within the lower spine. So what we're getting there is just a sort of almost a reflex spinal reaction of high stepping, and that suggests that there's degenerative problems happening in his lower spine there. So it's important that we have these kinds of records, because we might think, well, if a bear was having osteoarthritis or having pain, that they would drag their legs or that they might limp. And yes, we certainly may see scuffing of the foot pads, we might see scuffing of the nails, that can happen, but we might see some of these other different changes as well, such as this high stepping gait that can present a little bit differently. And then CCTV for your monitoring. Really useful if you have bear species that are in torpor and hibernate through the winter, and of course really essential if you're breeding to monitor mother and cub interactions, as well as just being really, really cute. Okay, so what else can we do in terms of health assessment? Well, there are a few different biological samples that we might want to collect that can be really useful. So if you are engaged in training, and I know Jay's done some presentations around training already, but if you're interested in training, if you want to develop your training, then think about training your bears for procedures that are useful from a health point of view, because that's going to be helpful for your bear as they get older. So we all know that positive reinforcement training involves the addition of a reinforcing stimulus following a behavior that makes it more likely that the behavior will occur again in the future. So in order for positive reinforcement to really work, that reinforcer has to be something that the bear really wants. And again, offering choices, not assuming that just because the bear liked one thing one time that it will like it for the next 20 years is a really important part of that. Sorry, apologies. Sound seemed to have been right. So what we want is a bear that's really keen to be trained, and this bear is really keen to be trained. So he learned a long time ago that his training session starts when the slide closes, and you can see he's really keen for that slide to be closed because he really wants to start his training session. And that's kind of the way that we want all of our bears to feel about their training. Now, we would generally now recommend that bears are not closed in for training. It should be voluntary, and they should be available to leave whenever they want to. This is an older bear with quite an old video, and when his training program first started a number of years ago, then this was how they trained. And now they wouldn't normally close the slide. It's just that he prefers it closed because he knows then that his training session would start. But generally what we want is for the bear to be able to leave at any point. If you have to close your bear in for it to participate in training, then you have to really consider how rewarding that training session is. If the bear has to be locked in to engage in training, then that would tell me that if that bear could choose to leave, that the training session isn't what it wants to do. It's not choosing to participate, it's not a voluntary process, and therefore it's not a positively reinforcing process. So even though you might be giving it food, that bear isn't enjoying that experience. So we do want that highly motivated, voluntary participation. And that's really important as our bears age, because we want to see that same enthusiasm, and training gives us a really important opportunity to be able to assess our bears up close and assess a lot of those physical parameters that we've talked about already. Okay, so what kinds of information can we get through training? Of course, we get that up close examination, so we can look at all of the things we've already talked about. We can tray for weighing, so to climb into a weigh cage or onto a weigh scale. We can train for injections, and that's really important, particularly as our bears age. There's an increasing likelihood that they will need anesthesias, that they will need further investigations for some of these health problems, and we really need to think about how we can do that in a minimal stress environment, in a low stress environment. We might need training to administer medications, training for sample collections. There are times when we might need to separate our bears if they have a particular injury or they need recovery from surgery. So getting them used to not always being with their cage mates can be quite a useful practice. And then clinical follow-up, so just assessing how bears are doing after a procedure, checking if a medication that we've administered has had a positive impact or not had an impact at all. All of those kinds of things are really important. And of course, training in and of itself, if it's done in a way that the animal is enjoying that process, is cognitively really enriching, and they're enjoying participating in that process. So it's just an example of quite basic training. This is with a bear in Romania, and this was a bear that had never been trained before in his life. And this is just him after a little bit of rapport building. So this is about 5 minutes into his first ever training session, and you can see that he's got the target there straight away. So this is Jay, just doing a bit of training with him, and this is just a nose target using a tennis ball on a stick. So he's not going to be perfect at it. He's never done it before. He's an old bear. He's in his 30s, and he has never seen a target before. So it's important that we take it at his level and that he doesn't become frustrated. But it shows that you absolutely can teach an old bear new tricks. Training helps us to give individual medication to our bears so that we can make sure the right bear is getting the right medication at the right time, because we can call them in, we can separate them, we can administer that medication to them. And we can also collect biological samples from our bears, so and view inside their mouth. So we've mentioned dental disease already. You can see the polar bear up here on the left-hand side is doing an open mouth behavior, so we can see the teeth. And then this brown bear is just doing blowing into a cup, and this is for saliva, or licking into a cup, sorry, for saliva collection. So that saliva can be useful for things like cortisol studies. Cortisol is a stress hormone that can give us information around how stressed that bear might be feeling. So that can be quite useful. But we can also, if that bear, for example, had an infection or nasal discharge, we could potentially also, if they're taught to target their nose forward like that, we can collect those kinds of samples. Blood sampling and injection training are also really helpful. I don't have a video for this one, unfortunately, but you can see that this sleeve has been added. It's a modification to the existing den door, and the bear puts its front leg in and grasps onto a bar and is taught to target at in that position. And then over time, we can introduce the clippers, alcohol for cleaning the skin, and eventually needles and syringes for things like blood sampling. And for injection training, you would probably just do a station right next to you would just do a station right next to the bars. You wouldn't do anything as complicated as this. And for intramuscular injections, you can just inject into the shoulder. So weighing, we've touched upon already. We can weigh in different ways. So if you have pre-existing dens that you can't modify, you can use things like cages that have a weigh plate built into them. Or if you're able to get weigh bars into your existing dens, then that can be really useful as well. Biological samples that are often helpful from a diagnostic point of view in our older bears are things like urine and feces. So collecting those things in a way that is clean and that we know which bear it's come from is quite important if you've got groups of bears housed together. Hair samples and saliva samples. So these can all be really useful from a diagnostic point of view. And these are all things that can be accessed through training. So we know that our bears, as they get older, show these significant pathological changes, and that can have a significant impact on animal welfare. And so by developing this portfolio of different physical indicators and training processes, we can start to build up a picture of what's normal for our bears, and we can start to then evaluate those changes over time to make sure we're picking up on these subtle signs before they become advanced, before we get these severe pathological changes, and before we get this significant detriment to bear welfare. And we'll just talk a little bit more detail about why that matters from a welfare point of view. So one of the biggest consequences of this deterioration in bear health is pain. And we see pain with a lot of the chronic disease processes that we're concerned about. So a little bit of terminology here, and I'm not going to go into this in too much depth, but just to make the next few slides clear, is that when we talk about pain, there are actually two different processes going on. One of those processes is something called nociception. Now, nociception is that stimulation of receptors in the peripheral tissue, so in the skin and the muscles, by an unpleasant stimulus. And those receptors, as I mentioned earlier, are the same ones the nerves that feed those receptors are the same ones that also respond to temperature and pressure. And that's why pressing on a wound helps with mitigating that pain response. It's why holding a hot water bottle when you've got earache, helps with that pain response. It's because you can confuse those receptors. They can't transmit the pain response at the same time as they transmit other sensations. So that's nociception. And that helps us with being able to manage pain in some ways. But pain itself is an experience produced by the brain. So it's not just about that peripheral injury and that peripheral stimulation. It's what happens in the brain when it detects that injury, when it detects that sensation. And this is really important because it's why pain thresholds differ from person to person and very much likely from animal to animal. And it's why if you're feeling a bit depressed or you're in a poor emotional state, you are generally more sensitive to pain. If you're generally happy and optimistic, you have a much higher pain threshold than people who are negative or pessimistic. And that's really important for our older animals as they get older, because if we can generally make them feel emotionally well, if they are contented and engaged and active in doing behaviors that they enjoy, then that can help to mitigate their pain experience. So a painful experience is a combination of that injury to the peripheral tissues and also the processing of that injury, that stimulation by the spinal cord and the brain. And because of this, pain is very complex, and we have to take into account the sensory and the emotional aspects of it, because it's the unpleasant feelings that cause the suffering that we associate with pain. So pain's not just about how it feels, it's about how it makes you feel. And this is particularly important when we look at our chronic pain states, because chronic pain makes you depressed. It is debilitating, and it leads to really unpleasant emotional feelings associated with that chronic pain state. This is a bear that's just waking up from surgery, and this is what I would call an acute pain face. Now, in lots of species, including humans, dogs, pigs, cats, we have an array of validated studies around what we call the Grimace Scale. And Grimace scales are a way of assessing acute pain or sort of short-acting sudden pain, because all mammals seem to have a similar response to that sudden pain. And if you think about humans, when we're in pain, if it's severe pain, we will make a pain face. So we tend to close our eyes and squint, we furrow our brows, we tense our mouth, and that makes our cheeks bulge a little bit. And all animals also have that same facial expression. So what we tend to see is a lowering of the head, a tightening of the eyes, squinting of the eyes, tension around the mouth, and flattening of the ears, and bulging of the cheeks as well in some species. But that's often a sign that the animal is in pain. Now, we don't have validated pain scales for bears because nobody's done that work yet, but there's no evidence that they wouldn't have a similar response, and my experience would be that they do have that similar facial response as other species. So there are different types of pain that we might want to be interested in, and this is important because it's important when it comes to managing those different types of pain. So again, more words, but we have three primary different types of pain. The first one is nociceptive pain, and this is pain that's caused by damage to tissue. So actual injuries will cause nociceptive pain. If you have a cut or a wound, or you break a leg, that's a nociceptive pain experience. Neuropathic pain occurs when there's damage to the nerves. And sometimes this is a pain sensation, but sometimes it can actually feel like a numb feeling or a burning feeling or a feeling of pressure. And that's because, again, those same nerves that transmit pain also transmit pressure and temperature sensations. And so if those nerves are damaged, we might get a whole range of different sensations associated with that. So if we have damage to the spinal cord or damage to nerves after an amputation surgery, for example, we might get this type of pain. And then the last type of pain is inflammatory pain. And this is because of local inflammatory chemicals that are released at the site of inflammation. So when you get that redness and swelling, then we get inflammatory pain. And the thing that's important is that these three types of pain are not mutually exclusive. They can all occur at the same time. So if we think about injuries, what kind of pain do we think might cause those injuries? So just to have a think about that in your own heads, or type it in the chat if anyone wants to type in the chat. You don't have to, but if you want to, you can. So the types of pain we might see with an injury would be things like nociceptive pain, so that injury-related pain, that tissue damage pain, and usually also inflammatory pain, because that area will often become a bit red and swollen. It might get infected, and that can lead to inflammation. If we have broken teeth, where the pulp, the center of the tooth that has the nerve exposed, is exposed to the outside world, and we get infection in there, and we can also get a range of different types of pain. So we might get nociceptive pain, so that initial pain to the actual injury, to the breaking of the teeth. We may well also get inflammatory pain, so redness and swelling, because infection can travel down that center of the tooth, and that causes that infection can cause inflammation. And we may well also get neuropathic pain, because each of those teeth has a nerve to the root of it, and that nerve could be damaged, and that can cause neuropathic pain. So we might actually get a burning or tingling sensation in the face related to that damage as well. Similarly, when we have changes to the spinal column, so on the right hand side, this is a relatively normal bear spine. You can see that each individual vertebrae is nice and sharp and clean. And this is a bear with osteoarthritis. You can see that there's a lot of fuzziness around each individual vertebrae. This is all arthritic changes, and there's actually fusion of the spinal cord along here. So this is where the bones have sort of, as a response to the abnormal pressures on them, start to try and lay down new bone, and you get all this extra bone formation. And what that does is it pinches the nerves that come out between the vertebrae, and that can cause multiple different problems. This is a knee joint, and you can see similarly here there's lots of fuzziness, and this is arthritic change in the knee joint. And again, with this elbow joint, we can see that all the fuzziness here of the elbow, which is arthritic change. And so when we get this sort of chronic degenerative osteoarthritis over time, then we get nociceptive pain, because we get wearing away of the cartilage between the joints, and the bones start to rub on each other, and that's actual injury to the joint. We get inflammatory pain, so those joints will become hot and swollen associated with that. And we may well get neuropathic pain as well, because the nerves surrounding these joints will also potentially become inflamed. And if we get arthritis in the spine, then the nerves exiting the spinal cord may well become pinched with all of this extra new bone that's being formed. And that can cause quite significant pain. So the reason that I'm laboring this point about the different types of pain in our older bears is because we have a whole range of potential different drugs that we can use to manage pain, and we tend to use very small numbers of these drugs, or very few types of these drugs. And some of that is tradition, some of it is because we have a lack of data and safety in bear species, and so we tend to sort of stick with what we know. But some of it is because we don't really think about the different types of pain that bears might be experiencing. And that's important because different types of medication will target different types of pain. If you have a bear with osteoarthritis, for example, the drugs that we typically give for osteoarthritis are what we call the non-steroidal anti-inflammatory drugs. Now, you might be familiar with some of these drugs. They're drugs like Metacam or Rimadyl, Carprodil, different types of the COX inhibitors. So they're commonly used for osteoarthritic pain, and they can be really, really effective because they're really good at nociceptive and inflammatory pain. However, what they don't do is manage neuropathic pain, that nerve pain. So if we've got arthritis in the spine and we're getting pinching of the nerves in the spine, you might start your bear on a pain relieving medication, and you might not notice any difference. And that's because you're treating the nociceptive and the inflammatory pain, but you're not treating the nerve pain, the neuropathic pain. So you might think that your drugs aren't doing any good and may stop them, or think that it's not worth the investment. But it's really important that we understand that these degenerative conditions can cause multiple types of tissue damage throughout the body, and therefore often require multiple types of different pain-killing drugs to address that pain experience. And this is really important in our older bears that may be suffering from multiple different health problems causing multiple different types of pain. So this is obviously something that you would discuss in conjunction with your veterinarian, but what I would say is, just as a take-home message, is that if you have a bear where you've noticed some of these changes that we've talked about occurring as they've gotten older, and you think your bear might be painful, then don't, if that pain doesn't seem to respond to just one drug, then don't give up or assume that it's not painful. We do often see abnormal repetitive behaviors associated with pain. We see, as I said, increased sleeping and resting behaviors associated with pain. So being, mindful of the different types of pain is important in making sure that we really are addressing that pain. Okay. And this is just to say, this is how pain occurs in our bodies. So we have that painful stimulus. It's transmitted through a nerve into the spinal cord and then up into the brain, where we experience it as pain. And the brain is really clever and actually sends out some neurotransmitters and chemicals to try and mediate and reduce that pain experience. But this descending pathway reduces over time and is less effective with chronic pain. And that's where our medicines help, because different drugs work at different points along this pathway. And so whether you're dealing with a bear that needs long-term pain management, or you're dealing with a bear that is having a surgery planned, which might be painful, it's really important to understand this, because the different drugs that we use in terms of pain management will work at different points. And that means that we can use multiple drugs safely without being worried about overdosing. And they're much more likely to be effective. And finally, just to touch upon for the last couple of minutes is just, we'll touch upon health assessment under anaesthesia. I'm not going to go into this in any great depth. I think it's just important to recognise that our older bears, we are able to anaesthetise these bears safely. There's often a lot of anxiety around general anaesthesia in older bears, and that's a good and reasonable anxiety, I think, because we want to be sure that we're covering all of our bases and that we're not going to do anything that may be detrimental to our bears. We do need to think about when we might anaesthetize them and try and plan that for the best time of year. So if we have a bear that is a seasonal bear, then planning your anaesthesia for when they're at the absolute heaviest will make it more challenging. When they're lighter, it is a bit easier for a number of different reasons. We want, ideally, if it's a non-emergent situation, to have that training in place so that we can have a stress-free induction through hand injection. If we're going to be doing something painful, even if that's just something like x-rays, that will probably be very painful for an older bear. Just anaesthetizing and moving an older bear will be really painful because of the pressure and the stress on the joints as they're being moved around under anesthesia. So we want to make sure we get that pain-relieving medication on board. Want to monitor their blood pressures, make sure that they don't have any underlying heart or kidney problems that might be problematic. And we want to get as much information as possible to make sure that we're aware of any concurrent disease problems that they may have prior to anesthesia. And the one thing that I can't emphasize enough is that whenever you have a bear that's under anesthetic, get as many samples as possible and examine absolutely everything. If you're anaesthetizing a bear for a dental exam, make sure you examine the eyes, make sure you examine the nose, the lungs, the heart, take x-rays if you can, feel the abdomen, ultrasound the abdomen if you can. Do all of those things, because anesthesia is a real opportunity to collect as much information as possible about problems that you may not be aware of. If you're able to take things like spinal x-rays or joint x-rays, that can be really helpful in identifying any of these early degenerative changes that may occur. So there are obviously anaesthetic risks with any animal, but often I think they are overstated. In bears, some of the key times for anaesthetic risk tend to be around the induction, when we administer anaesthesia, and in the recovery, when they're recovering from anaesthesia. And this is usually due to risks of asphyxia. So bears will often, when they go to sleep from anaesthesia, will want to put their head in a corner and bend their necks, and they very easily obstruct their own airways. So just monitoring them really carefully and making sure you get a tube in, or that you're keeping the neck nice and extended, can be really helpful. And then the other time that we tend to see problems with bears under anaesthesia, particularly larger bears, is when they've been on one side for a procedure. So this photo on the right hand side is a dental procedure on a brown bear, and with him we had him on one side for one root canal to be done, and then after a while we had to turn him over so that the dentist could get to the other side to perform the other root canal. And when you do that, the side on which he's lying, often the blood pools on that side, and it means that the lung gets a bit solid and dense and the blood pools in it. And then when you turn them over, that solid congested lung is on the top, and suddenly then you can get problems with breathing. So making sure that you have a good oxygen supply is really important for those aspects. There are times to be really cautious with bear anesthesias. But being aware of those risks and managing them is really important, because it allows us to get much more detailed information about things that we wouldn't necessarily see. So things like cardiac, heart disease, liver disease, etc., etc. Okay, so we'll just touch very briefly on prevention. I'm aware I'm running out of time, so don't worry if you have to go. Just wanted to emphasize again, really, all of the things that I think have been talked about in previous webinars that we've delivered. Think about your bear's environment. Think about maintaining that muscle tone through environmental enrichment and training programs. Think about, physiotherapy for their bodies and keeping them nice and active, keeping their brains cognitively active. We've not really talked about cognitive decline, but we do see cognitive so degenerative changes in the brain in a similar way that we do with other animals as they get older. They're going to be more likely to become anxious, more likely to become scared, particularly of noise triggers. And all of those things are also wrapped up in that pain experience as well. And these are reasons why we often see an increase in abnormal behaviours as bears get older. So keeping them as active and cognitively engaged as possible through training and enrichment is really important. Making sure they've got a species appropriate diet and that we're considering their normal seasonal rhythms is also really important. So when you're optimizing your bear's husbandry, you want to review yourself and your own behaviors and how you interact with your bear. Are you doing things because you enjoy them, or are you doing things because your bear really enjoys them? So I think training is one of those things that we all enjoy. We enjoy that lovely close contact with our bears, but we need to make sure that our bears are enjoying it and not just going through the motions. So evaluate yourself and your routines. The enclosure and the enrichment, it is difficult when we're all really busy, but particularly as they get older, what can we do to optimize them? How can we make some of those fun things more accessible? How can we keep them active? How can we keep them engaged is really important. And know your individual animals, track any changes over time. If your bear has always enjoyed a particular enrichment and then they suddenly stop interacting with it, think about why that might be. Is that enrichment too high or too inaccessible, and actually your bear's a bit painful and can no longer reach it? Perhaps they've stopped climbing or they've stopped digging in the way that they used to. So think about those things. And then just another resource which might be of interest or use to you is just around managing some of the abnormal behaviours that we see as bears become older. So those abnormal repetitive behaviours can occur for a whole variety of different reasons, including previous trauma and frustration with the environment in which a bear is kept. But we also often see an increase in these abnormal behaviours associated with pain and associated with anxiety and cognitive decline as animals age. So if you're seeing increases or new developed abnormal repetitive behaviors, then starting to think in a systematic way around how we can manage those is useful. And I don't have time to go into that in detail in today's presentation, but just that there's a reference there if anyone's interested. Again, if you're looking for a tool to help you assess your bear's welfare in a holistic way, in a way that we know is reliable, then again, this paper's open access, and there's a whole range of resources associated with it in terms of training tools and guides as well. And it also helps you to recognize what you're doing well, which I think is really important. We often focus on preventing poor welfare, but I think what's really important is also to recognize what your bear really likes, what you're providing that's really good, and what you're doing really well. And it's important to maintain that as well. Okay, so remember that you and what you provide is really important to your bear. The relationship you have with your bear is important. And there's lots that you can do as a keeper or a bear caretaker to ensure that you are collecting information which can be really helpful in the early detection of geriatric bear problems. And I think if we could be a lot more proactive around that, then we probably wouldn't see some of the more urgent bear welfare problems in geriatric bears that we tend to see. Okie doke. So thank you very much for your attention. I've just seen that there's a couple of questions in the chat. If anyone has any questions, then please do pop them into the chat and I will be happy to answer them. Okay, so a question is, where should we draw the line with non-invasive assessment to decide on a full check under general anaesthesia? I'm a fan of, I think this depends a little bit on your facility, on the skills and resources that you have available to you. And I certainly know facilities that don't anaesthetize their bears very often, or really only when it's very urgent, because perhaps the vet is reluctant to, and they don't have the skills and equipment and resources that they feel like they ought to have. And that can certainly be a problem for bear welfare. I dealt with a case recently where the bear was showing very clear clinical signs to me of pain, and the local vet disagreed and did not want to anaesthetize the bear because he felt like she would definitely die under anaesthesia. And to me, that is a problematic assumption, because this bear was showing really clear signs of pain that weren't being managed, and she actually died of natural causes a few months later. And for me, that's an ethical problem. I think if an animal's dying of natural causes in that situation where they've had clinical signs, then we as vets haven't done our job properly, because we should be more proactive than letting that happen and letting that suffering occur. In other situations where it's perhaps not that severe, and you do have the skills and the resources and the capacity to be able to anaesthetize bears, I don't think there's a hard and fast rule. Certainly there are zoos that try and do annual health checks of their geriatric animals, including bears and other large carnivores. And I think if you have the resources and the facilities to do annual or every 2-year health checks, that can be really useful. But it also depends a little bit on what kind of information you can get through training. So if you can get things like blood samples through training, if you can do regular visual examinations and you're not seeing any deterioration in mobility, you're not seeing any other problem signs, your appetite and activity are really good, the bear's in great physical condition, it's behaviorally normal, then you might not want to anaesthetize because there's no real indication to. So I think it really depends on the situation, what abnormal signs you are seeing, and what the impact of those abnormal signs are on the bear's welfare. So if you have a happy, healthy bear who is behaving normally, who has no clinical signs, then you would have probably a less strong argument for general anaesthesia, which is fairly invasive, than if you have a bear who is showing signs of problems that you cannot manage. Having said that, having healthy baseline clinical data is very useful. So because again, you can track changes over time. So that is useful. So I don't think there is a hard and fast rule there, but I think it does depend on the individual bear and on the facilities and skills available to you.
Thank you so much. We have a few more questions here. So if we could just attend one by one, so I can just read for you the next one. What are the most common diseases, metabolic disorder you have witnessed in geriatric bears? Plus, are endocrine disorder also common in bears?
So probably the most common endocrine disorder that I have experience of is hypothyroidism, so a low thyroid hormone. And we do see that in bears. It can sometimes be a seasonal shift, so we have to be really careful when we're again, this is where having the baseline data is really helpful. We have to be quite careful that if we're sampling bears who are going into torpor, they will metabolically down regulate, so they will have lower levels of a lot of their normal metabolic markers than if we had sampled those same bears in the middle of the summer or the autumn, for example. So we do have to be a bit careful and make sure that we're interpreting any kind of blood test results or anything like that in conjunction with understanding that bear's activity and what is normal for that bear. But probably low thyroid hormone would be, hypothyroidism is probably the more common metabolic sort of disorder that we see.
Yeah, I found the thyroid actually quite a tricky gland in bears, and probably also in others, so seasonal. And then there is not much of the research about the thresholds in different seasons, so it's quite difficult. So I wish we would have more data on that. So if anyone of the participants actually have something about thyroid to share, then please do. We can continue the discussion about those interesting things and more of your questions later also through our Facebook page. And another question from Marta. When we have our geriatric bears under chronic pain treatment, do you use stomach protectors and liver protectors as well?
Yeah, that's a great question. I think we're often concerned around side effects of some of the drugs that we use, and I think that's perfectly reasonable. I think it depends what medications we're using. So I know that was a bit of a whistle-stop tour of pain relief in this situation, but there are lots of different types of drugs, and different types of drugs have different side effects. So we tend to use stomach protectors with our non-steroidal anti-inflammatory drugs, so things like Metacam or Rimadyl, Carprofen, those kinds of drugs, and all of the other sort of non-steroidal drugs. The newer drugs that we see on the market, there's a whole host of new ones that we have in small animal medicine that are applicable to bears, are much more selective about the inflammatory mediators that they affect, and they tend to be less risky in terms of things like stomach ulceration, which certainly could be a problem previously. And so I think it's not unreasonable to use stomach protectors, but if you have a bear on long-term non-steroidal anti-inflammatory medications, I think it's something to sort of consider on a case-by-case basis. In terms of liver protectors, not generally. Most of the pain-relieving drugs that we use in bears are metabolized and excreted via the kidneys, and bears have quite interesting kidney physiology, again related to their hibernatory requirements and the fact that when they hibernate, urine sits in their kidneys, and because of that, they have evolved to have very dilute urine compared to other species, because if they didn't, then they would end up with kidney stones really easily when they were hibernating. So they often have much more dilute urine than other species, and that means that they seem to be we don't tend to see kidney injury in them related to some of the drugs that we use in a way that we might be concerned about with dogs and cats, for example.
Okay, thank you. Here about the drugs and all these protectors, etc. I would have a follow-up question if I can. Then what what about the drugs that are more for this neuropathical pain, and then the side effect might be also kind of addiction? Have you experience with this kind of then withdrawal syndrome or this kind of problems?
So the drugs that we tend to use for neuropathic pain are generally not considered to be particularly addictive drugs. So the two primary ones that we might use for neuropathic pain are the sort of tricyclic antidepressants, so things like amitriptyline and then gabapentin. Evidence basis for them in bears, and I mean, nobody's done those studies, so we don't know exactly how they work, but we do seem to see clinical responses in bears. So and we don't tend to see any sort of what we might consider to be addictive concerns around those. They're not particularly addictive in humans at the doses that we use them in. And in general, what we find with those types of drugs is that the way that they work is because they are fulfilling a deficit of the neurotransmitters in the brain. And so if you have a painful animal, all they're doing is restoring its neurochemicals back to a normal level. So you're not providing it with an enhanced experience. You're just moving it from a painful experience to a normal level of functioning. And so you don't tend to get that sort of addiction response. There's also a whole load of stuff around addiction in humans, which is around psychological dependency. And we tend not to see that so much in animals as well. So
okay. Yeah, interesting. Thank you so much. Then there is another interesting question here. How should we care geriatric bears nutritionally? Is there an ideal proportion of carbohydrate, protein, lipid, and minerals? Plus, do you recommend any nutritional supplements or antioxidants?
I think the honest answer is I don't think anyone's done that research. So no, we don't know what an ideal combination of the macronutrients would be. And of course, it would vary from species to species. So what might be ideal for something like a sloth bear is going to be entirely different for what might be ideal for a polar bear. They occupy very different ecological niches. They have very different diets in the wild. And so I do think looking to the literature around wild bear diets and how they feed themselves in the wild is really useful. I think trying to make sure we're providing a range of different foods, and in our seasonal bears, trying to provide them with a sort of seasonal equivalent. So we might want to be upping our sort of proteins and fats and sugar supply, sort of carbohydrates in the autumn when those bears are hyperphagic and really looking for those extra calories, and then reducing the sort of the nutritional quality of their diet and it being more sort of roughage based in the spring when they're emerging from their torpor. In terms of nutritional supplements or antioxidants, I think there are certainly commercial preparations available, again, mostly marketed towards sort of small animal veterinary practice, that things like liver support, for example, that again, no one's done any studies in bears, but may potentially be helpful in terms of things like liver health. I think for older bears and any older animal, really ensuring that they have a diet that's adequate in vitamin E is really helpful, and antioxidants generally are going to be really helpful for ensuring cellular integrity. I have seen cases of bears that have had really very poor diets, and then as they've got older or become active, or they've had maybe a bit of a scuffle with another bear, or they have been very active in their enclosure, they have developed a problem that we traditionally associate with capture of wild animals. So it's something called rhabdomyolysis, and it's where the muscles actually are so stressed by that sudden exertion that they start to break down and melt. And that releases a load of toxins in the body, which then causes secondary damage to the kidneys. And that's often seems to be associated in bears that have really low levels of vitamin E. So I don't think that's a problem really for most zoo bears, but certainly in older bears, it's something to be mindful of, is that vitamin E can be quite helpful as an antioxidant.
Okay. The questions are piling up. What we don't manage within the reasonable time, then we will be continuing on our Facebook page, as I said. There is a question about the list of the articles you referenced during your presentation. I believe we can share some that are open access, and some already have been shared on our website and on our Facebook page. So please, everyone, have a look there. And then the question about any bear-specific welfare assessment forums.
Forums. So I think not bear-specific welfare assessment forums. I don't think that they exist, to be honest. But the EASA YouTube channel, so the European Association of Zoos and Aquaria, have a really good animal welfare YouTube channel that has a whole bunch of presentations around welfare assessment generally across a range of species. And obviously the bear tags, the taxon advisory groups in around the world are have some useful resources around bear husbandry and optimizing bear husbandry as well.
Okay, thank you. There is a question following up with training. So are there any particular behaviors that you would recommend we train to help our bears with muscle support and pain management?
Sorry, sorry, Agnieszka, just going back to the question, I think I misheard it. So it was any welfare assessment forms.
Forms, okay, my pronunciation.
Sorry. Forum. So in the paper that I mentioned, and I'll post it on the Facebook group as well, there's a welfare assessment form in that, so welfare assessment tool.
Okay, sorry everyone for my English, but then we achieved more information, like bigger picture of everything. So now the question about bear yoga.
Yes, that's a great question. I think that certainly keeping activity levels high is really good for that muscle support. The muscles support the joints, so we tend to see early degenerative joint changes in bears that perhaps are kept in environments where they are not able to exercise very much when they're young. So encouraging climbing behaviors, encouraging foraging behaviors, encouraging digging behaviors is all really great at maintaining that muscle tone. Thinking about landscaping your enclosures so that they're not totally flat, so you've got some varied topography, is really good at exercising different muscles as bears go uphill and downhill. And then in terms of training specific behaviors, I think, things like full hind limb stands are really helpful at assessing mobility, and just being able to target and move bears from side to side so that you can look at their gait is really important. But I think from a sort of training behaviors for physiotherapy, I think that's difficult because unless you spend long periods of time doing it, it's probably not going to have a significant impact. So I would say use your training for assessment purposes, and then think about your enclosure design and enrichment for that sort of physiotherapy and activity side of things.
Okay, there is also a thank you for a great presentation and really interesting one. I think everyone would agree about that. I mean, we have the greatest overall picture that we could possibly can in the amount of time given. But I would also have one more kind of a comment maybe to everyone, because we need to gather all kinds of data, as you also pointed out throughout your presentation. And I believe that the keepers who see the bears every day, they are usually also having a part of this knowledge about them, also kind of good intuition. And sometimes there is something that is very discreet and they notice. So I would also recommend that they are stubborn in achieving the check, or kind of suggesting when they notice or somehow feel that something is off. So it's kind of a general comment. And
no,
just go ahead.
I think that's really important, Aga. I would say to any vets that might be listening to this presentation, if a keeper comes to you and they have a concern, please, please, please listen to them. So the cases that I quite often deal with are when keepers reach out to me because they feel like they are banging their heads against a brick wall because they know that there is a problem with their bear. They know their bear isn't right. There's something is wrong with it, and they don't know what, but they know that something is wrong because they see that bear every day and they know that something is wrong. And the vet who sees it once a week, once a month, once every couple of months comes in, looks at it and goes, no, it's fine. I can't see anything. It's fine. And I think that is one of the biggest problems in terms of zoo veterinary medicine, is that quite often as vets, we don't listen enough to keepers. And I think it's really important that we do that.
Yeah, fully agree. I also happen to kind of stepped into this kind of discussions and problems. And sometimes what I find helpful is also just to gather everyone and discuss and then have all the points of view, because in general also, I mean, with geriatric bears, the care is also difficult by means of not only that bears as bears, they are quite discreet. So the changes might not be as abrupt as we would somehow wish them to really properly decide. But yeah, just kind of talking through and then exchange the ideas and have all those different views. We have to adjust everything for the geriatric bears. So we see that the diet is also important, and then sometimes physical features also in the enclosure, and yeah, from different angles we need to provide much to properly care over them. Mm-hmm. One question out of curiosity: what was the older bear you have ever dealt with?
The oldest bear I've ever dealt with? Yeah. Oh, I actually don't know. I've certainly dealt with a number of bears in their mid to late 30s. So but this is going to sound awful. One thing that I would say, and this is an entirely different topic for a different day, is that I do not think, and certainly the evidence does not support, that longevity is an indication of good welfare. It's an indication of regular food and a lack of predation or competition, but that's not the same as good welfare. And I think we need to very much move away from celebrating old age and look objectively about quality of life in our old bears, and make sure that we are providing them with good pain relief, that we are providing them with an enriched enclosure where they can be active. Because unfortunately, the oldest bears that I've seen are often the ones with the poorest welfare, and people don't want to make difficult decisions around that welfare because they're old and they have a birthday and it's celebrated every year. And I think that it is very difficult when you're emotionally attached to your bears, but I think that, providing good welfare is all about putting the animal's experience first, even when that's painful for us. And it's really important that we objectively evaluate welfare, particularly in our older bears.
Yeah, thank you so much for this comment. So just after this, a little bit of provocation, and sorry for that, because I fully agree with you. Then I was stunned by the list of some disorders that the bear, aged 49 years, brown bear, happened to live that long, what he actually experienced in his life. But then sometimes we have this neuropathic pain, sometimes we have the fusion, they cannot move properly. Like, how long we should actually alleviate the pain when we know that there is no proper medicine for this kind of pain? So is there any kind of threshold you would advise to keep before considering
So this is why I think your welfare assessments and collecting all of this data around behavior and activity and physical health parameters is really important when bears are young and healthy, and as they become into middle age and then into old age, because what we actually want is to keep that normal baseline of activity. If you have a bear that can't climb, can't dig, is spending 18 hours a day lying down, sleeping, and is not in torpor, then we really need to be thinking, well, that's not normal behavior. And so we really need to be considering, well, why is the animal not choosing to engage? Why is the animal, what kind of quality of life does that animal have? And so, and that's the same with any medication. It's really important that we evaluate a response to that medication, because if it's not working, then we need to start considering other options, because otherwise we're keeping an animal alive in chronic pain. And just because a bear is eating, you know, bears will eat. I've seen bears eat with 4 kilograms of tumor in their liver, that are, you know, and they're essentially dying in front of you, and they will continue to eat. So we can't use those highly evolved, metabolically driven behaviors as a baseline for good welfare. Good welfare should be about engaging in things that they enjoy. It should be about positive emotional experience. It should be about playing and engaging with enrichment and exploring and interacting with their friends. And if they're not able to do those things because they are chronically painful, then we either need to address that pain or we need to start making some difficult decisions.
Okay, thank you so much. I think this could be our conclusion for today, somehow nicely wrapping up what we are aiming for in the proper care on over the geriatric bears. So I would like to thank you everyone for joining us here, and then yeah, please have a look at our website and also our Facebook page. We will continue to discuss with you some hints and important points from today's discussion, and also the resources, as someone asks for. So don't worry, we will share whatever we can share with you. So yeah, we might also want to follow up with you with the survey. So please have a look at your email and also our Facebook page and the website. So thank you, everyone. Heather, if you would like some few final words, then please.
Just thank you very much, everyone, for your attention and participation. And if anyone has any follow-up questions or wants to chat further, then please do reach out to us on the Facebook page.
Okay, thank you, everyone.